Hello, everyone. Welcome to this session of Talking Tech, Women and Girls in ICT. My name is Florence Mulenga, and I am 22 years old. I am currently pursuing my bachelor's degree in pharmacy at the University of Zambia. I recently conceptualized an anti-asthma body spray that could potentially prevent asthmatic patients from going into an asthmatic attack, and I have won 4 national awards for this concept with an extra international award for entrepreneurship. Today, I am delighted to be representing Girl Up, and I am excited to be having a discussion about tech and tech careers with Dr. Nadine Housri. Now, Dr. Nadine Housri is a co-founder of the Mednet, the largest Q&A site for physicians in the United States, and assistant professor of radiation oncology at the Yale School of Medicine. Now, she has received grant funding from a number of prestigious organizations, including the National Science Foundation, and has published over a dozen peer-reviewed publications in major journals such as Annals of Internal Medicine, Annals of Surgery, etc. Her work has been featured in the New York Times, Inc. magazine, Stat News, and TechCrunch. She is a graduate of the University of Miami, Miller School of Medicine, and she completed her fellowship at Yale and her residency at Rutgers. Dr. Housri is an alumni of the Clinical Research Training Program at the National Institutes of Health and Y Combinator, a startup accelerator in Silicon Valley. That's amazing. But before we begin, we would also like to enlighten all of you about what Talking Tech is. Talking Tech is a series celebrating girls and women in tech being recorded around the world between Girls in ICT Day 2020 and Girls in ICT Day 2022. Girls in ICT Day is an international day marked on the 4th Thursday of each April. So meaning in 2021, Girls in ICT Day is on the 22nd of April. The objectives of Girls in ICT Day are to help to create a global environment that empowers and encourages girls and young women to consider studies and careers in the growing field of information and communication technologies. Now, the Talking Tech series is brought to you by the ITU, UNICC, and the Office of the UN Secretary General's Envoy on Youth, and is in support of ECOS, which is the Global Partnership for Gender Equality in the Digital Age. Now, Girl Up is pleased to be a partner on this session today. The goals of the series include interest and inspire. So the goals actually are to interest rather and to inspire girls and younger women with information about a range of ICT careers that can be had to them. Another goal is to bring before a broader audience some of the role model women in tech and share information about their career journeys and work. Offer diverse examples of how ICT is being used to support achievement of the Sustainable Development Goals and other UN goals. Showcase initiatives that are working with girls to support them in ICT studies for future ICT careers. And to also provide girls and young women in tech with a leadership opportunity to represent and promote a Girls in Tech organization with which they are involved and promote it to a broader and international audience. Now, to kick this session off, I am going to introduce to you Girl Up. So I'm going to talk a little bit about Girl Up, the organization that I am representing. So Girl Up is a campaign of the United Nations Foundation dedicated to securing equal opportunities for underprivileged adolescent girls in developing countries such as Ethiopia, Malawi, Zambia, India, etc. Since Girl Up's launch in 2010, they have partnered with the United Nations to support comprehensive programs that give adolescent girls in developing countries an equal chance for education, health, social and economic opportunities, and a life free from violence. For more information about Grow Up, you can visit www.growup.com or .org. Trust me, you really want to be a part of this. I am delighted to now shift this conversation with Dr. Housri. But before I begin, Dr. Housri, how are you?
I'm good. I'm delighted to talk to you today, Florence. I admire your work as well, so I'm excited to do this.
So, Dr. Housri, tell us how and when did you start the Mednet?
A number of years ago, when I was in training, when I had completed medical school and I was doing my oncology training, my own father was diagnosed with cancer. He's doing very well now, but at that time, I knew that the best outcomes were from physicians who were experts, who are the ones who are at the universities doing research in a specific area. Their patients did the best. So I wanted the best treatment for my dad, and I started to reach out to experts all over the country. I sent them emails, I got on the phone with them, and really I was just asking them questions about what recommendations, what treatment they would recommend for my father. And this is something that physicians do all the time. We ask experts our questions. Most physicians have a very large breadth of practice. They see a number of areas within their specialty or within their general practice, but a smaller number are in universities and are studying very specific diseases and doing research and clinical trials in the area. And we look to those experts for guidance on how treatment is changing and what the most cutting edge practices are. So at that time, my older brother watched this whole process. He saw me send the emails. He saw me get on the phone with experts. His background is in technology. He really has no medical background. But he was so surprised at two things. Number one, how much expert knowledge is just trapped in their heads. Oftentimes, you really, the know-how, the how-to of medical practice is trapped in the heads of these experts. And then number two, when it is shared, it's shared in a very one-on-one way. It was, via email, on the phone, maybe it's in the hallway of the hospital. It's never really documented and shared with other physicians who could really learn from these experts. And so my brother Samir and I, we started to work together and we decided, hey, why don't we put these conversations online, these questions that we ask experts and the answers that they give, and put them online so that other physicians can learn from them and deliver better care to their patients. And that's how the Mednet started. Originally, we started only in cancer because that was my specialty. But since then, we have grown outside of cancer to include a number of other specialties as well.
Wow, that's really touching because, in most cases, when someone has a challenge, they'd rather just sit and be sad about it. But you went ahead and decided to do something and provide a solution to the whole world because of a challenge that you were experiencing. And I'm glad to know that your father is doing well right now. So you and your brother just sit down and discuss, what, let's do this and let's do that. Was it something that you were scared about? Because I feel like that you'd be like, are we really going to do this? So what was it that you were feeling? Were you scared or were you sure it was going to be a success?
Oh, I was very, very scared because I had not done anything like this before. I hadn't gone to world experts and asked them to participate on, some platform that I had built. I was scared just to tell them about the idea. I was scared that they would say that's silly. No one's ever going to use this. But I've actually found that once I started to talk to experts around the country, they were really excited about it. And that got me more excited and less scared.
Wow, that's amazing. So your feeling and your brother's feelings were mutual. How was he feeling about it?
He was less scared. So we were both very confident that it was the best, something that was good and that would help other people. The thing that I wasn't sure about is whether the experts would actually participate. Would they go and answer these questions online and share their knowledge, knowing that thousands of other physicians are going to read them and then that could impact patients all over. And so that definitely reassured me and got me excited to keep going forward with the concept.
That's so amazing. That's really, really amazing. I mean, especially for someone who's really pitched like a business idea before. Like I feel it's something that's nerve-wracking, but you just went for it and you never doubted yourself. So, anyways, we shall move on to the next question, which is how has been your journey before the Mednet and after the Mednet? So how has been your life before you designed the Mednet and after you designed the Mednet? What differences have you observed?
So before the Mednet, I really was on the path to go into academic medicine, to be a clinician, and to be an academic in a university where I would treat patients, but I would also do research at the same time. I've actually still do those things. So my path has not changed too much in that way. I still see patients. I still do research. Obviously, a large part of my life or my career now is working on the Mednet. I think the nice thing about what we've done is I've actually gotten to know so many physicians all over the country, not just experts at academic centers, but physicians in community centers, these really smart physicians who have a very large breadth of knowledge, who are treating patients, many patients, sometimes seeing 30, 40 patients a day, very, very busy. And I've gotten to meet them and to learn about the struggles that they go through. And the Mednet really is there to help serve them and help them take care of their patients. So that's probably been, the one aspect that if I had gone down the academic route and I had been an academic physician, I wouldn't know, this huge number of physicians outside of academics. I wouldn't understand their struggles, with their needs, and work on something that really helps them.
I'm just imagining probably when you were 10 years old, you never even imagined that, this big thing that you were going to do, but probably you had the desire to do something great and to have positive impact on humanity. And we thank you for that. So I remember when we had a chat before this, you mentioned how you are the co-founder. So what is your main job in the Mednet itself?
So, a founder basically at a startup does a little bit of everything. But my position is the chief medical officer. So generally, I manage the editorial teams, the editorial process, the content, the community. And I oversee all of that. We have a really fantastic team of editors and medical directors who I work with and I talk to all the time. And so that's the gist of what I do. Coming up with new ideas for the Mednet, talking to users, talking to physicians all over the country, and trying to figure out what are we doing right, what could we do better. Basically, that's the gist of my day to day.
I think that's really exciting, especially, the interaction with different physicians, because now you get to think on a bigger perspective, like you get to think outside of the box the more you interact with other physicians. That's very, very exciting. I'm sure people are thinking, oh my goodness, she's this genius. She doesn't do anything outside. So what activities do you do outside the Mednet that you would like to share with us today?
So outside of the Mednet, I also am an assistant professor at Yale, and I specialize in thoracic oncology. So I treat lung cancer patients with radiation. It's an important part of what I do and who I am. In terms of hobbies, in COVID, it's been a lot less, but generally I like to be active. I like to run. I like to ride my bike. I like to spend time with friends. I love to spend time with my family, my husband, my brother and sister, and my nieces and nephew, and my parents.
That's so amazing. Someone would think, no, she doesn't have an ordinary life. No. Talking about going for a run, riding a bike, spending time with family. That's really amazing, And it actually gets to show that people can actually have like a balance between having a busy life and just having their day-to-day activities. Mm-hmm. So you did mention about how you're specialized in radiology and oncology and all that. There was a time we learned about radiation in school, and I've always been scared to be near anything that has to do with radiation. How do you handle the fear of that? Because for me, I'm so scared of that.
Yeah, no, that's a valid fear. And radiation is pretty amazing because it has the ability, on the one hand, with diagnostic radiation, we can do all this imaging and we can look inside someone's body without having to cut them open, which is really amazing. And then what I do is treat cancer with radiation. So we can use these X-rays that you can't see, you can't smell, you can't touch, but they somehow kill cancer cells, which is, remarkable in and of itself. Radiation's been around for over 120 years for the treatment of cancers. And a lot of the practice is really focused on safety, doing it as safely as possible. We're focused on delivering high doses of radiation to cancer cells and protecting not just the normal tissues, but also people outside of the room. So there's a lot of safety measures that go into radiation oncology, and it's something that we think about every day.
So, okay, what do you like best about the Mednet? Like, what makes you wake up each morning and say, I want the Mednet to grow and expand? So, what do you like the most about the Mednet?
I think the thing that brings me the most joy is hearing from other physicians how much it helps them take care of their patients. Oftentimes I'll get emails or I'll see colleagues and they'll tell me, they won't say I like the Mednet, they tell me I love the Mednet. And that means a lot. They say, like, I don't know how I would do my job without it. This really helped me make better decisions, take care of my patients. I learned about new research on the Mednet that I hadn't heard about. So that's my favorite aspect, just seeing how much this has helped my colleagues around the country deliver better care to their patients.
That's amazing. That's really good. That's like creating positive impact on a daily basis. Mm-hmm. That's amazing. Another question would be, can you share like an example or two of things you have done in the Mednet that you are really, really particularly proud of?
Yeah, so the most recent thing I can think of is in this past year, when the COVID pandemic broke out, a lot of physicians had questions about how they should be treating cancer patients. So at that time, in the medical world, we were canceling a lot of elective surgeries, elective procedures. We were telling people to stay home. We were trying to minimize any contact between ourselves. The hospitals, especially in the United States and the area that I practice in, were really overrun with COVID patients. And so, cancer treatment is not elective. It's something that has a sense of urgency to it. And so for cancer physicians at that time, we had a lot of questions of, should I delay treatment? Should I modify my treatment? How can I get my patients in and out as quickly as possible? How can we reduce exposures to our patients? How do we protect our staff? And a lot of those questions were posted on the Mednet very early on in March of last year. And we were able to rapidly, reach out to the people who are developing the protocols and the practices at their institutions to share them with the rest of the community so that the rest of us could learn and figure out in this emergency time how we could still take care of cancer patients and deliver the best care while protecting them and protecting other clinicians and staff and from COVID. We actually published our experience with this over the summer, and we were really proud of how we were able to get this knowledge out there very quickly. And we had a lot of feedback also from physicians who said, this is incredibly helpful for them in figuring out what to do during these early days of the COVID pandemic. The other thing we did at that time is also share the questions. So there was national societies, like professional societies, who were coming up with guidelines for physicians, and we were able to share our questions with these societies so that as they're coming up with their guidelines, we were saying, these are the concerns that physicians have. Can your guidelines answer these questions? So that was really wonderful. Another thing that I think that we're really proud of is the Mednet really functions to answer questions. And one of the ways that we answer questions on how to treat patients is through clinical trials. So the reason we run clinical trials is because we want to know, is this new drug better than the old drug? Is this other type of treatment better than this type of treatment? And that's really how we get the best answers for how to take care of patients. And so one of the things that we've done, and we've partnered with the National Cancer Institute, is to start raising awareness to clinical trials among physicians who maybe don't always think of clinical trials, don't know if the trials are available to their patients. So we had gotten some grant funding to do a pilot project, and we still work with the National Cancer Institute to try to raise awareness to clinical trials.
Speaking of clinical trials, how did you go about that? Because that's a lot of work to handle,
Yeah.
Was it you started easily, or maybe there was a lot of planning that had to go into it?
Well, in all honesty, I think the roots of it really started back when I spent a year at the National Institutes of Health when I was a medical student, learning about clinical trials and how to run trials and all the aspects of clinical trials. And it really it instilled in me an appreciation for clinical trials. And it was always something that I had been thinking about, is how do more patients get on clinical trials? So in the United States, only 2 to 5% of cancer patients go on clinical trials. And that's a real problem because these are the trials that change the standards of care, that lead to new drugs and new treatments and cutting edge technologies being widely available for patients. So it was something I had thought about for a while. And I think it was a natural transition as I got involved with one of the clinical trial groups under the National Cancer Institute. It's called SWOG, or Southwest Oncology Group. And just having dialogues with them about how the Mednet could help their mission and help raise awareness to clinical trials. So it was a very slow process. It's a very big and daunting endeavor. And I think it's something that we'll be working on for many years.
What lesson have you learned along the way that you'd like to share?
I think the biggest lesson that I learned early on was what we spoke about earlier with being scared. Oftentimes we reject ourselves before we give other people an opportunity to reject us. So the biggest lesson that I learned is really don't reject yourself. If you have an idea, if you have a concept, if there's something that you want to work on, don't let that little voice in your head say, you're not good enough, you don't know what you're doing, there's smarter people who can work on this. Because what you might find is that once you start talking to people and you start working on it, that actually people are not going to say that they're smarter people. You're not going to find that someone else is working on it. You're going to find that you're that person who should be working on this project. But if you reject yourself from the beginning, you never will get to that point. So don't reject yourself before giving other people an opportunity to reject you, because they might not reject you. So I think that was probably the biggest lesson I learned early on.
I really, really needed to hear that, because many other times when we just disqualify ourselves, before we are actually before we're even disqualified, already saying, no, I can't do that. I can't really do that. But that's really amazing. And really, that's very powerful. I needed to hear that. I am going to go for my dreams now.
I'm glad to hear that, Florence.
Okay, so have you encountered any challenges along the way? And if any, how did you manage to overcome them?
We encounter challenges every single day. So anytime you have a new idea, it's always hard. My mother used to tell me, if it was easy, everybody would have done it. And the biggest challenges, I think, is getting in front of people. Having people listen to you. Often you'll send. I'll make a phone call or I'll send an email and I don't get any replies. So I send another email and I send another email. So often that persistence does show up, that does pay off in the long run. I think that's been the biggest challenge, is sort of like put this in front of people. Once people see the Mednet and physicians start using it, they get it right away. And they always say, this is something we definitely need. But the biggest challenge is that your target audience is people who are very, very busy. And so how do you reach people who are very busy? I think that's been the biggest challenge.
Do you plan on expanding outside the United States as well?
That's a great question. So we do. In the short term, in the next couple of years, we're focused on expanding across all of medicine in the United States. But beyond that, we do want to expand internationally. I think the key is that we want to make the platform useful for every single person, every single physician who uses it, which means that if you're a physician in Zambia and you ask a question, that answer should help you in your current practice. It should be, you're going to get a recommendation from someone who uses a drug that's not approved in your country, or a sort of technology that you don't have access to, that doesn't help you. So expanding internationally, but in a way that it's incredibly helpful for people no matter where they are.
All right. Wow, amazing. We can't wait to have it across the world so that we can be able to use it as well, I'm sure a lot of physicians would really love to have it huge platform where they get to ask questions, they get to get answers. So I think that would be really great for the whole world as well. The last question would be, since this is a series about girls and women in technology, do you have any career or tech advice for girls and younger women in tech? But then I'd like to expand that question on, would you like to also give advice to young girls who are aspiring to be physicians just like you? So what advice would you give in general for tech and for being a physician, just in general?
Yeah. To show up, right? If there are opportunities that are available, just, you don't know where it's going to take you. So I would say it's always, the advice that I always give is to show up. Another thing is to be focused. When you find things that interest you, really, really try to focus on it. Try to learn everything that you can about it. Oftentimes I think where people might, they're interested in maybe 20 different things and they're kind of not very focused, and that can make it difficult to try to, like as you did, focus on one thing that's really interesting, learn everything you can about asthma and the treatment of asthma and different technologies and medications that are available, and try to figure out how you can make a difference. In terms of going into medicine, I think it's the same sorts of things, in terms of trying to be focused on your studies. There's a lot of distractions for girls out there, and most of them are not particularly helpful. I think when you're a young girl and you're growing up, the best thing that you can do for yourself is really focus on your education, because everything else is, all the trends and all the things that are hot and flashy at the time, they're not going to suit you, later on in life. And try to also make friends who are like-minded too, because oftentimes they say you're the result of the people who are your 5 people you're closest to. So if you really want to focus on your schoolwork, then you're going to want to have friends who are also focused on their schoolwork, and you all succeed together.
Well, thank you so much, Dr. Housri. I've learned about being persistent. You told me about the rejection in the emails, how you have to be persistent if you really want something. Because my friend and I, honestly, I think we could even have thousands of screenshots of rejected emails, but we never gave up. We just kept pushing. So for me, I've learned about persistence. And I also noted down what your mom told you, that if it were easy, people would not have done it. Like not everyone can do it. If it were easy, everyone would have done it. Sorry. Yeah. So that's really amazing for me as well. And how you've talked about focusing, if you want something, focus and try to learn as much as you can in that particular field. Anyways, you can ask me questions and then I'll be quick with my answers.
Yeah, I would love to know how you got interested in asthma and how the body spray came into being. I think it's an amazing idea.
Oh, okay. So for me, back in 2019, there was a competition that was announced for Zambian girls to participate. So the competition was basically coming up with an idea in the biosciences field and combining it with entrepreneurship. So you have to solve a global problem while making money out of it. So many people were so scared to apply because they're like, how do I come up with that? How do I think about that? So for me, I was like, I really want to participate, but then I don't have any idea. So I went back to my book. I tried to research as much as I can. And then I was like, what's really close to my heart? And then I remembered that most of my relatives and family members who have asthma, you can't use strong perfume or anything that might trigger an allergy in them. They would go into an asthmatic attack. So I was like, this is really close to my heart. I think let me think in that field. So I started thinking, what if we could design a body spray whereby, because you know how for an inhaler, you keep inhaling, that's the shortest route to your respiratory system. So I was like, what if we had a body spray that when you put it on, you are constantly inhaling the medicinal components of it, and it's keeping your airways stabilized constantly 24/7, so that even if you encounter an allergy in the environment, your respiratory system will not start constricting. It will be stabilized the whole time. But of course, there has to be a lot of research done to it, because you can't constantly keep inhaling something medicinal all the time. So, but then this is the idea I applied with, and we had judges who were experts, you know, they would know if something is not going to work or if it's going to work. So that's what I used to apply with, and there were hundreds of applications all across Zambia, and 15 of us were chosen. That's how I won the whole competition. And from then on, it's been award after award because of the concept initially.
Amazing. I think that we have that in common, is that you saw a problem that was very close to your heart. You saw something that your family members had gone through, and you're like, well, how can I think of a way where they don't have to struggle with this anymore? I love that. What are the next steps for you?
Okay, so I would like to take it up for my master's, because it's just very difficult to actually convince people to fund you for something as big as that, because, you know, pharmaceutical products take like billions of dollars to be funded. So if I can take it up for my master's, it would be easier, because equipment would be everywhere, and it would be easier for me to prove my work, and it would be just very easy to convince people that, you see, I have papers, and what I'm talking about can work because I have done this, that. So for me, I feel I'll take it up for my master's. But initially, the future, I really want to be the Director General of the World Health Organization.
Oh.
Yes, so I really want to be that, and I would really want to be a financial investor, because I've noticed how many people have great ideas, but then they just don't have the funding. So I'd like to also be part of the people that fund startups and just see them grow and become the best that they can be. So I'd really love to do that.
That's amazing. Well, honestly, the first step is motivation. So a lot of people will say, "Oh, I could never do something like that." And again, you know, maybe you can, of course. Why, you know, somebody has to become the Director General of the World Health Organization. I think I also really admire, you know, not a lot of people your age say, I really want to get into investing in startups. And that's something that's incredibly important, because we need a lot more women who are involved, you know, from the investing side, to look for new types of ideas, new technologies, especially the ones that are affecting public health. I think we have a lot of people investing, you know, games and things like that. That it's nice to see someone who's passionate about public health and with that type of mindset. So I really hope you do succeed in that endeavor.
Thank you. That wraps up our session today for Talking Tech, Women and Girls in ICT. Thank you so much, Dr. Housri. Like, I have had an enlightening moment. You're a very insightful person. Honestly, I don't think anybody can have a conversation with you and come back the same, because it's different. You get to learn a lot from just a conversation. I mean, it's only been 38 minutes, and look at me, I'm already learning all these things, you know. So for me, that was really amazing, and I feel that everybody that will watch this will be enlightened, and they will be empowered to dream big and to go for their dreams, because this has been totally amazing. So I really enjoyed our chat today, and thank you so much to our viewers for joining us today. Thank you so much.
Thank you so much, Florence. This is great. Take care.
Thank you. Bye.
Bye-bye.